About 5 years ago, I was taking care of a patient. I had actually delivered her 2 kids, and she rolled into the emergency department dead from an overdose. And it changed my life. I actually talked to the emergency room physician. I'm like, what happened? And he said, duh, there's an opioid crisis. Where have you been? This opioid crisis for the United States started back in the 1980s. To bring it home to North Carolina, on average 5 people die every day in North Carolina from an opiate overdose. And one of the things we have is we have a huge workforce deficit. Only 11% of people in 2016 who disclosed that they had an opioid use disorder and said, I want help, were able to find a provider. MAHEC was founded in 1974 because there was a healthcare need or shortage out in Western North Carolina. The number one way that we treat opioid use disorder in the United States, but particularly in North Carolina, is through something called Detox and Abstinence. So they can go into an inpatient facility for 14 days, 21 days, or 90 days. But we know from the day they get out, 90% of them will be using again within 6 months to a year. The thing that buprenorphine does is it takes care of 2 things. It makes sure that they don't withdraw, but then it takes care of the cravings. So if we get them on the right amount of medication, it'll make their cravings essentially 0, and then they can do life.
To see someone really close to death in 6 months with a job and their child back in their arms makes all the difference. And even though the work is so hard and can be so challenging sometimes, the reward is so great. And that's why we do what we do.
The real way that we're going to finally get on top of this opioid crisis is through prevention. One thing we're doing is trying to teach providers that are out there how to write opioids safely, which is a lot less or none at all. But another is getting to adolescents. 90% of people that have a substance use disorder started using before the age of 18, but 50% started before the age of 15. So we really need to target that population with this preventative strategy. One of our preventative strategies is a flyer that we've distributed to over 200 schools in 17 counties in North Carolina, and it's a flyer that goes to parents, and it's to empower them to ask questions if their child were to get, say, injured and be in an emergency department or see a provider, and that provider is about ready to give them an opioid. When they have those conversations, then providers are much less likely to write opioids at all.
There are statistics that show that children are less likely to attempt drugs in the home if there's a conversation going with their parents. So I wrote a children's musical called It's Just a Pill, which deals with the opioid epidemic, the risks of opioid misuse, and also teaching about proper use and disposal of drugs. We were able to take the play to 6 different counties in our state, 3 of which are in Western North Carolina, 3 which are on the east side of the state. And in that time, we have had a viewership of approximately 4,000 people, mostly children. We put together a whole packet of curriculum and materials and resources for each place that we present. Overall, it's been very favorable. People are asking for more. I've had more inquiries to roll it out.
This is important work because the bottom line is it comes down to saving lives. But what we know is to save lives, we have to train more providers. We received funding from the state of North Carolina to train up to 10 residencies in this waiver training called buprenorphine training. And we are on track to almost double that by the end of 2019. But there's literally 10 times more residents and residencies that need this training. At UNC Health Sciences at MAHEC, we are leaders in expanding access to medication-assisted treatment or buprenorphine for patients, but we are just getting started.